On this edition of the Best Docs Network featuring Forest Park Medical Center, Dr. Glenn Ihde, Dr. Jeffrey Cattorini, Dr. Michael Musacchio, Dr. Richard Salter.
And hi again, everyone. Jim Knox along with Candace Kruger, and welcome back to another edition of the Best Docs Network featuring Forest Park Medical Center. Of course, Candace, Forest Park Medical Center, one of the top medical centers in the entire Dallas-Fort Worth area.
Indeed it is, and we'll start off with our first Best Doctor who operates right here at Forest Park Medical Center. It's Dr. Glenn Ihde.
Once we've diagnosed reflux and we're sure that we're dealing with that entity, then we can talk about treatment. And a lot of people think that we just skip straight to medications, but in fact, most people initially recommend lifestyle changes.
We tell people maybe elevate the head of your bed to help gravity take effect with the symptoms that may be occurring at night. Avoid eating late at night, eat smaller meals, avoid carbonated beverages, and avoid some of those trigger foods that may relax that lower esophageal sphincter and increase the amount of reflux that can occur. If those don't work, many people will go to over-the-counter medications. They may see their primary care doctor or gastroenterologist, and they may prescribe acid-reducing medications.
As people get reflux more often, they start using medications that actually prevent the production of acid. So the stomach content is less acidic, so when they do reflux, it doesn't burn. If you've been on those medications for more than 8 weeks, or you have to take them every day to prevent symptoms, or even if you're having symptoms while you're taking those medications, then it's time to think about surgery.
Reflux disease is normally a problem with the anatomy at the junction of the stomach and the esophagus. And there's usually a hiatal hernia that can accompany reflux disease patients. And when we go and correct that anatomical defect, you can basically help restore that normal anatomy to where patients do not have to take their medications any longer.
So the newer procedure, what we call a transoral fundoplication, tends to provide the treatment without the complications. So if you're taking the medications for a long period of time, if you're symptomatic on those medications, then now might be the time to think about turning towards a surgical procedure that can recreate the anatomy the way it's supposed to work.
Is a minimally invasive procedure that's done without incisions, and it's very helpful in treating the reflux symptoms and as well as decreasing the amount of side effects that was seen previously with the other types of surgery.
Before we even start the surgery on the patient, we actually review the plan. The 3D analysis that was obtained from the CAT scan allows us to see the knee in real time. And this allows us to see the orientation, the alignment, and actually the size of the implant that we'll use. So I can actually look with 3D technology to see exactly what the implant looks like, the alignment, the rotation. As we get into the surgery, I can actually make adjustments in surgery to balance the ligaments inside of the knee as well. So once we place these pins into the bone, we attach what we call arrays to the pins. And this allows us to consistently always know the position of the bones at all times. Once we register both the patient's anatomy and register the robot, then the next step is to actually begin the surgery itself. So I can slowly chisel away the bone that's necessary. When I look at the screen, the green data tells me the extra bone that I must remove. What's critical is this robot will not allow me to go outside of the plan that we've instituted in the very beginning of surgery. The surgeon is actually still doing the surgery. The robot is just allowing the surgeon to do it in a more precise manner because the robot will not let me deviate from the plan at hand. Then the next step is to trial or place the implant to see if it fits correctly. And as you can see, it's perfectly aligned, the rotation is perfect, and as a surgeon, it's very exciting to see that we can do this reproducibly, consistently, and do it successfully. This technology allows us to do surgery with the smallest incisions possible. Our patients are recovering much quicker than the traditional approaches.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center.
I assess patients based on their nutritional needs, if they are at nutritional risk, if I need to do any kind of intervention as far as medical nutrition therapy, which is prescribing certain diets. For example, if a patient has diabetes, then we would order a diabetic, heart-healthy diet so that it would fit into their meal pattern to help control their blood sugars while they're here at the hospital.
Having a culinary team in place definitely gives us an avenue to provide great meals. We feature anything from gourmet pizzas to ready-made salads to order. Everything's prepared fresh right in front of your eyes, and we try to do that in a timely manner.
Forest Park Frisco Cafe Services incorporate patient and family members into our dining experience. So if there's something available down in the cafe that is not on our written menus that a patient can select from, it's still an option that a patient can receive those items from the cafe directly onto a tray up to a patient room.
With Krista, we follow a pretty strict menu that we put out of the back, but then there's also special people with allergies or people that can only have certain things. We're a small enough hospital that they really get a personal care. She touches the patient every day. She brings down the information to us, and we take care of whatever culinary needs they have.
We have people from Frisco City Hall that come and frequent our dining establishment quite often, and they let us know how well we're doing. And I thought it was pretty unique to have people walk down the street, come into this facility. They're not patients, and they don't have any family members here at the hospital, but they just want to try us out because they've heard from other staff members that work with them of how good the food is.
Our menu is not typical hospital fare. It has a lot of, I'd say, Texas twist to it. It's anything from fine dining up in the doctor's lounge to some of the caterings that we do for the doctors, and then down here we try to do things a little more regional, use some of the local produce, try to make it more of a resort-like setting.
Food and nutrition is a lot about lifestyle changes and lifestyle behaviors, and those things don't happen overnight. So what little coaching that I do get to give patients here in the hospital is mostly through a paper that they can take home with them and do some extra research on it. We try to give contact information for the dietitians as well, so if they have questions post-op, there's always someone available or some kind of way to get the extra information that they may need.
Very, very strong congestion in my nose. Could not breathe whatsoever. Started about 5 years ago, I started taking nasal sprays. Back then it was more of a 1 or 2 day type of thing, maybe once a day to be able to get some relief to breathe. And just as the years went by, it started getting, progressively worse.
Frequently individuals come in with their biggest complaint being that they just cannot breathe through their nose. Often they are addicted to some of the common over-the-counter nasal decongestant sprays, which is a bad thing. These patients often they use them several times throughout the day, and the problem with that is that you somewhat become addicted to them in the sense that the more you use them, the more you need it. You can have a rebound congestion in the nasal linings and the passageways. So it can cause a big problem with just persistent nasal obstruction. So we're going to order a CAT scan on this.
Eventually, it got to the point where I was having rebound congestion from the nasal spray. So which I didn't know about. My girlfriend had to warn me, you know, you got to stop taking this stuff. And I was like, no, it's no big deal. It's just nasal spray. It shouldn't be, you know, any harm to you. But, you know, after reading the congestion and reading the back of it and seeing that it was dangerous and it does cause rebound congestion, it says it right there on the label.
So there's two different types of nasal sprays. There's the over-the-counter ones, which are typically the decongestant nasal sprays. Those should be only used for a short period of time. The ones that can be prescribed by a physician, such as the nasal steroid sprays or antihistamine sprays, can be used on a daily basis indefinitely. The nasal sprays that are prescribed by the physician are not addictive in the way that the over-the-counter ones are, and do not cause that rebound congestion and the problems that some of the over-the-counter decongestant sprays do.
People don't realize how precious being able to breathe is. And you know, with my job, I have to be able to sleep. And before Dr. Wyll, I wasn't able to sleep maybe 3-4 hours a day, and I was constantly up getting nasal spray trying to be able to catch some relief to breathe. But now, you know, basically nights full of sleep. I mean, it's great.
Ashley has a question for Dr. John DeLimba. What are the signs and symptoms of endometriosis?
There's several symptoms that women will experience with endometriosis, and you don't have to have all of those symptoms to have endometriosis or to suspect that you have endometriosis. First is heavy and/or irregular bleeding, painful periods, lower back pain with your periods, painful intercourse, lower back pain, loose bowel movements, and oftentimes a genetic component to endometriosis. So your mom, sisters, aunts, cousins might have had the same symptoms.
All of the doctors featured here on Best Docs Network are all about changing people's lives. Like our next Best Doctor, it's orthopedic surgeon, Dr. Stephen Michelsen.
I had pain in my right knee, and at that time I did what's called a procedure called microfracture surgery, which is a normal procedure where you infuse blood in there to create a cartilage-like feel in your knee, and that was in my right knee. Then in 2010, I had pain in my left knee, and at that time is when Dr. Michelsen told me about the new procedure called Carticel.
ACI is basically stands for, it's an acronym for autologous, which means from the same patient, chondrocyte implantation. And it's a procedure that's done for cartilage damage in the knee. So essentially, the surgery is a two-stage procedure. The initial surgery is where the knee is scoped and any other abnormalities within the knee are taken care of. The second surgery is a more extensive surgery involving what we call an arthrotomy, complete opening of the joint. The cells are implanted at that time, and then the patient goes through a little bit more extensive recovery. That recovery starts off slow, sometimes using crutches and braces and not bearing weight on their leg, to about 8 weeks where they're without brace, walking on it. But those cells take time to mature, and that maturation occurs over the course of about a year.
In May of 2011, we went in and took out cells so we could grow the cartilage, and then we had the full surgery in December to sew in the grown cartilage and go from there. Within 3 months, I was back at the gym on a pretty regular basis, and then within 6 months, I was doing even more strenuous exercise. And then now, 10 months later, I'm actually jogging on a treadmill.
It has been all but to hold back the reins on him. He's back up, he's running, he's jogging, saying that his knee feels better than it has in a very long time. He's had an excellent outcome.
It's funny, you know, when you first have the surgery, all you think is about that knee. You feel it in everything you do in every walk of life right after the surgery. But then, of course, today, I don't even think about the knee now. And that's probably the best endorsement of all. Dr. Michelsen is a really good doctor. Thank you, Dr. Michelsen, for giving me my legs back, so to speak.
Welcome to Forest Park Medical Center, Southlake. It's coming to fruition. You can see it behind me here. You know, the best way to describe Forest Park Medical Center is imagine if you had physicians that could actually lead and build healthcare the way that they wanted it to be built. Lots of people build hospitals and design the systems in which we deliver care, but rarely are they physician-led and physician-driven the way that they are at Forest Park Medical Center. So as a physician-driven organization, a physician-envisioned organization, we deliver healthcare differently. And it's no more evident than looking at our buildings. You know, if you've not had a chance to walk through Dallas or walk through Frisco, and soon, in just a couple of months, be able to walk through Southlake, it's just different. It feels different. The idea is to take the healing environment to a different level. So we all know that really scientifically, the environment that we heal in makes a difference in how quickly we heal, how well we feel about the process, and that level is taken to its epitome in the Forest Park Medical Center facilities. And it's very, not just visual in the cosmetic appeal, but from a LEED certification standpoint. Our buildings are LEED certified, which means that we're really leading the industry in healthcare in terms of not just the look of the environment, but the healthiness of the environment. So it's a cleaner environment, essentially, and it's more environmentally sensitive. The whole idea that it is physician-led, it's how physicians would want healthcare delivered if they really could control 100% of it, and they never have been able to, but here they do. The people make all the difference. So the folks that are touching the patients are extremely customer service oriented. Hiring the right people makes all the difference in the world. There's going to be a couple of hundred people in the building, and we hand select and pick the best and brightest, both technically and from a compassion standpoint. I'm really looking forward to providing some leadership to the team that are innovative in bringing a different way of delivering healthcare to Texas and of course now here to Southlake.
For more information on any of the doctors you've seen on today's show, just visit our website. It's bestdocsnetwork.com, and be sure to click on that Forest Park Medical Center tab.
All right, Candace, now to another outstanding doctor who operates right here out of Forest Park Medical Center. It's neurosurgeon Dr. Jeffrey Cattorini.
Trigeminal neuralgia is a disorder where patients have lancinating pain in their face, typically in one of three distributions, either supraorbital, infraorbital to the nasal region or nose region, or below the mouth to the chin region.
I went to the neurologist for about 3 months, and I wouldn't go the route of, because I am a single mom and ran my own business, so I couldn't be in the drug-induced coma. And I was asking really for a fix. I was like, I don't want to Band-Aid the problem anymore. I want this fixed.
Laura's case, she had trigeminal neuralgia for almost 17 years, and it initially manifested itself in her early 20s, and she underwent the medication route for multiple years and became ineffective to the medications and intolerant to them.
Well, at first, I thought it was just a toothache. It felt kind of like having your teeth drilled without Novocaine. And then it moved into the whole side of my face.
Basically, neuralgia is nerve pain. And if you think that patient has nerve pain, you treat it typically with seizure medications.
The actual nerve is about the size of a wire to your headphones to your iPod. What he did is cushioned the trigeminal nerve and then put me on back together again. And now my typical day is I go to work, I have a full day of work because I have my energy back. I get to come home and I go to dinner with my kids and we watch a movie and we're up till 10 o'clock at night after homework and everything, and it's a real day back again.
Laura had a good result from the surgery. We weaned her off the majority of her medications by 3 months post-operatively. She had some incisional numbness around her incision site, but she's much more functional, much more happier than she was preoperatively.
The pain is gone, and it's gone for good. He recognized that it was something that needed to be taken care of right away and didn't make me go through a bunch of red tape, and just took care of it.
Did you know that Forest Park Medical Center Dallas has the AccuVein Vein Finder? This allows the phlebotomist to actually see the vein before drawing your blood, eliminating multiple sticks.
Before I came to see Dr. Musacchio, I was having a lot of pain in my right leg to the point that I couldn't sometimes move, bend, or even walk.
Judy came to see me with a long history of a low back and a leg pain, and it was getting worse and creating more and more discomfort for her. The pain was starting in her back and go all the way down her leg. She did come after having seen chiropractors and failing to improve with that and trying other methods of treatment outside of surgery.
It affected just my everyday life. I could not sleep, I'd wake up in pain, so I knew I had to do something.
What we found was that Judy had not only an instability in her spine, and she also developed a degenerative cyst. These degenerative cysts can act much like a herniated disc in that they can pinch the nerve. And in pinching the nerve, it causes a significant amount of pain and discomfort to go down through the back and the leg.
He just really did make me feel comfortable, made me feel relaxed. I knew that I was going to do the right thing by doing the surgery.
The purpose of the surgery was to not only decompress the nerve by removing the cyst, but also to stabilize the spine so that the cyst didn't recur and to help alleviate her back and her leg pain. We did use a minimally invasive approach with Judy, and that involved doing a fusion and placing bone grafting and screws in the spine, but doing it in such a way that with a computer-guided system that creates somewhat of an intraoperative three-dimensional image of the spine that allows us to use a percutaneous approach, which is to say minimal muscle disruption, and really help the computer navigate the screws into the spine with very small incisions and very little disruption to the normal tissue.
The way I feel now compared to how I was feeling before is like night and day. Before, I was just in constant pain. Now, which I can move, I can bend, I don't run, but I could. Exercise, it's just totally different. It's totally different. There's absolutely, and when I say this, I mean absolutely no pain at all. I'm glad that I saw Dr. Musacchio.
Stephanie has a question for Dr. Pero. She'd like to know, can someone with severe allergies be helped with surgery?
A lot of patients have severe allergy problems, and many of them also have chronic sinus infection problems and or nasal obstruction. Sometimes those patients can be helped with surgery, and typically like to make sure that we have their allergies under as good a control as possible before deciding to proceed with surgery. In other words, the allergies themselves might be contributing to swelling in the nose, which could be contributing to blockage of their breathing, could be blocking the openings of the sinuses that lead to sinus infections. Our hope would be that we could treat the allergies by themselves, which would decrease the swelling enough to improve their airway and decrease the severity and frequency of the infections. In some patients, based on their anatomy, that's not possible, and those patients are ones that would benefit from surgical intervention.
For more information on any of the outstanding Forest Park doctors you see on today's show, head to the website, bestdocsnetwork.com, and check them out. Right now, it's time to head to our next Forest Park Medical Center doctor. It's Dr. Richard Salter.
The Da Vinci robot has been used extensively in gynecology since about 2008. And it allows us to do major surgery on patients that used to would facilitate a large incision, but now we're able to do these through smaller, minimally invasive incisions, allowing the patient quicker recovery and quicker return to our normal activities.
I work a full-time job. I perform on the weekends. I'm a jazz blues singer. The recovery time seemed to me to be a little bit more because of the weight issue. But the robotic procedure kind of lessens that fear.
Wanda was having a lot of pressure down below, and she stated that she felt like things were changing inside of her. She knew she had the fibroids, but she felt like they might be growing again. We did a sonogram. It showed that her uterus and fibroids collectively were about the size of a volleyball, and definitely could be causing the pressure and the abdominal pain that she was experiencing. kind of like a muscle cramp in the uterus. And unlike muscle cramps in our other muscles, these muscle cramps don't go away, they stay.
He explained the process to me, and I said, this is the person who's going to do the surgery. And there's another procedure, but the procedure was done. And within less than 2 weeks, I did a performance. I was very pleased with the outcome.
Well, we did her surgery in mid-afternoon or so, and I saw her that night. She says, I really could go home right now, but I think I'll just stay. So we kept her overnight. The next morning she felt great. She was ready to get out of there. I saw her back about 2 weeks later, and she had already done her first performance. I think she said it was 10 days from the time she had her surgery to the time she was back on stage.
I know my doctor said, don't do anything, don't drive for at least 3 or 4 days, but I felt good, you know. So, you know, I would recommend this to anyone who is thinking about having this procedure.
Mark Vaggi is a 52-year-old gentleman with severe arthritis of both of his hips. We usually don't see arthritis in such young patients like Mark, so he brought a special, unique case to our attention.
The process started about 4 years ago, and it was just a slow deterioration over those 4 years. The simple things started becoming very difficult for me, so I knew it was time that I do something. I'm still young, I still trying to stay active, and I knew that this was something I really needed to do.
Mark is still working. His job is very important to him, and getting him back to his job as quickly as possible was a very important concern of his. So by performing bilateral hip replacement, both hip replacements at the same time, we were able to get him back to work much quicker than if we did one hip followed by the other. Mark had the anterior approach to total hip replacement. This is a special procedure in which we go between the muscles units instead of cutting muscle. Because we don't cut any muscle when we perform this procedure, the rehabilitation is much, much quicker.
At 1 month after total bilateral hip replacement surgery, my mobility and my overall condition is probably, I would say, 10% better than it was prior to my surgery.
Mark is back to work. He's walking independently without a walker or cane. If you didn't know Mark had both hips replaced simultaneously, it's very hard to tell because he doesn't even have a significant limp.
Not only am I happy about the decision that I made to get my hips replaced, I am excited about the prospects of actually being able to have a more active summer. I'm looking forward to this summer for the first time in a couple of years. I'm looking forward to getting back to doing a lot of the things that I really enjoy, and I'm confident that in the next couple of months I'm going to be right where I want to be.
That will do it. That'll wrap up another edition of the Best Docs Network featuring Forest Park Medical Center. Of course, Forest Park Medical Center, the top medical center in the entire Dallas-Fort Worth area.
For more information on Forest Park Medical Center or any of the doctors featured on today's show, just visit our website, bestdocsnetwork.com, and be sure to click on that Forest Park Medical Center tab.
And if you have a question or comment for us, we'd love to hear from you. Send us an email, info@bestdocsnetwork.com.
So long, everyone. We'll see you next week.